Before the first lockdown happened back on the 23rd of March 2020, I had quite a lot of appointments booked in for podiatry and renal clinic, doctors and diabetes clinic. And then all of a sudden we went into this lockdown with no warning about what's going to happen with appointments. I wasn't aware what was going to change in terms of appointments. It was a couple of weeks, I think, after the first lockdown in March, that I finally got letters and phone calls to say home visits will be made, phone call appointments would have to go ahead. That was quite nerve-wracking because when it comes to renal clinic, I like to be there. I like to do a face-to-face, find out what my function is and the bloods have been done and that kind of thing. My blood pressure is always quite high, so that's normally mentioned and dealt with in renal clinic. So it was quite strange to have a phone call appointment. I didn't feel like I could get everything across and what I wanted to say during phone call appointments. I got the letter from the NHS to say that I needed to shield for 12 weeks. So there was no going out of the house, no seeing any family or friends. It was all kind of just rushed into that's it, you're staying in the house with no information about what went on with appointments until the clinic started to call me and let me know what was going to happen. But for the first few weeks of that, it was pretty scary. I wasn't aware how I was going to be able to get groceries and medications. And even if I was allowed to go to appointments by that point, I was kind of in the dark and not really aware of who to contact to find out any of this information. I don't think was really suitable to my needs specifically. I felt kind of quite rushed on the phone and not really listened to at all because I had problems going on that I couldn't really explain, with, for instance, low blood sugars. I'd heard nothing at all from the diabetes clinic in quite a long time. So I contacted the diabetes nurse teams, and they contacted me back, I think it was about 48 hours later, to explain how to alter my pump and what ratios to change the insulin down to. But it was quite difficult to try and do the pump, listen to what the nurses were saying and work all out the ratios. And it was quite confusing at times because normally they'll explain and show me how to do this on the pump when I'm in clinic. So that was quite difficult to juggle all that in one go. In September of 2020, I went for a visit to my GP because I had a skin abscess under the arm. So she prescribed me with an antibiotic, and I wasn't aware that I could not take that antibiotic unless the immunosuppressant drugs for the kidney transplant I was on was reduced. So I just started taking the antibiotic as normal. I get a phone call the day after to say that my potassium had gone to a dangerous high level at 6.7 and that I needed to go back to A&E to get the blood test repeated. When I got to A&E, potassium's way too high, we need to admit you and we need to put these medications in and bring your potassium down. And I was really confused, not knowing what's gone on and why my potassium's gone high and my function's gone really low. They never explained anything in the A&E department about the knock-on effect that the antibiotics had had. And I'm just getting told you either come in or you're going to, you can have a cardiac arrest or a heart attack and then you can die. And then the renal doctor phoned me the day after and explained quite clearly what had happened with the antibiotic and why this treatment needed to be started and that it'll just be a few days. So I went to the renal intervention centre where the kidney doctor had explained to go, and they'll sort it all out there. And they was really helpful. They explained everything and why this treatment needed to be beginning as intravenously and the reason why I needed to come in. And I received fantastic care on the kidney ward. It was all explained and I had a better understanding of why it's not just a good idea to go home with high potassium. During the time I was sent to the A&E department, I was actually quite scared due to the coronavirus and the amount of patients that were going down there and being treated and the pressure that it's been putting on the doctors and the nurses and how much they've had to deal with and what they're still dealing with now today. I can kind of understand that things are tight and they're under a lot of pressure, so it's kind of rushed, but there is sort of a standard that they should be giving each patient, regardless of what's going on at that time. They are doing a fantastic job. They just need to be more clear and more understanding that that patient that they're dealing with is still a person and still wants to know everything that is going on with them. On my appointment with the dietitian on Thursday, she was phoning me initially because she was concerned about weight loss. So I explained the issues that I'd been having surrounding that, and she was absolutely fantastic. And she came up with options that would really help me, and nutrition drinks that she can prescribe, which would help me maintain some weight if I was having difficulty with foods. So she's already sent a letter to my GP and they've issued those. So that was pretty fast for the dietitian to do. She's made a referral with my diabetes doctor over to gastroenterology to try and determine what the problem is and why I'm losing so much weight. So that was fantastic. I finally felt like she'd absolutely listened to me, and she did everything she could to help, and that's an absolutely worthwhile appointment. The services that I attend, there is quite a few, but it does seem that there's not really much communication going on between each department. For instance, I was at renal clinic and they prescribed some antibiotics, and a few days later I had a phone call consultation with my GP, who then also needed to prescribe a different antibiotic. He told me to stop the first antibiotic to start the second one, and then within 5 minutes called me back and said, hold on a minute, who even gave you the first antibiotic? So it wasn't on the system, they wasn't aware of it, and so I felt like they don't really talk to each other there. And I do suffer quite high blood pressure, so the last Monday's appointment with the renal clinic, she was talking about starting an extra blood pressure tablet to coincide with the one I'm currently on. And I did explain to her that I'd taken that one before in the past and felt really unwell with it. I was so dizzy that I could not even stand up without feeling like I was going to faint. But she insisted that we start it anyway, but at a little bit of a lower dose, which is making me quite anxious and nervous to even attempt to start that. Maybe the GP should be made aware as well of the effects that I've had from their previous blood pressure tablet, and if there's not a different one that I could maybe start that I feel more confident and more safe for taking for me. And it'd just be a lot easier if things was on the system as a whole, rather than it taking quite a while to receive a letter from a different department. It'd be better if there was a system in place where every time you'd been treated by a clinic, it was then uploaded onto the NHS system as a whole for each department to be able to see what's going on. The most important aspects, I think, for me in things that can be changed is to be listened to more. A patient knows their own body, they know how they feel. If they've been through certain things in the past, then they know the symptoms of that and the signs of that.